In Maryland, the governor is asking for $60 million to combat the spread of the coronavirus. And tonight, 11 people are waiting for test results, although there are no confirmed cases in Maryland yet. WJZ's investigator Mike Helgren is live at the State Department of Health following new developments. Mike?
Denise, we expect those 11 pending results to come back sometime tomorrow. We'll likely know more in the morning. And Maryland's Emergency Management Agency has now upgraded its level to enhanced status, and that means there's more resources available to fight for and prepare for the coronavirus. While there are no confirmed coronavirus cases in Maryland, the race is on to prepare for a possible outbreak.
This is not a time to panic. This is a situation that we feel we have under control and we are managing, although it is rapidly evolving.
Governor Hogan has called for emergency legislation that allows for the transfer of up to $50 million from the state's rainy day fund. He will ask for $10 million more in a supplemental budget.
It is critical that we have the flexibility to immediately access these resources.
So far, 21 people have been tested in Maryland. 11 of those results are pending. 10 people tested negative.
The big goal here is prevention.
Dr. Clifford Mitchell with the State Health Department says many more who've traveled to highly impacted countries like China are being asked to self-quarantine.
There's a lot of international travel through Maryland by Marylanders and others. So it's not a small number, and it's a fair amount of work.
Maryland now has federal approval to do its own testing, meaning results do not have to be sent to the CDC in Atlanta and can be ready in as little as 24 hours.
If there is at some point a person who appears to be infected, we can act quickly.
In addition to state preparations, communities across Maryland are taking precautions. From Baltimore City,
if you are ill, please stay home,
to Howard County, where 911 callers with possible coronavirus symptoms are being screened.
Those questions will help us narrow down and provide information to our providers who are en route whether this might be a coronavirus case.
And the State Health Department has the massive job of taking inventory of every health care facility in the state, finding out what supplies they have on hand. Health officials are particularly concerned about the elderly who are vulnerable to coronavirus if it spreads here in Maryland. Live at the State Health Department, Mike Helgren, WJZ.